brings us to your weekly capsule of health information. We like to call it your healthy dose. You yawning this morning, Bunky? You feel tired? Wait a minute, you just got up out of bed. You had a shower. You should be awake. Well, if you're not feeling good, you may be suffering from some sort of sleep disorder. Here to tell us a little bit more about snoring and fatigue. I don't know if you were experienced, Aaron Zook, but you're here to talk about it. Thanks for joining us.
Well, it's one of those things I hate to admit I might be a little experienced at it.
Yeah, I might be too, and I know my wife is. So many people I hear, they are diagnosed with this thing called sleep apnea.
Mm-hmm. That's right. And sleep apnea, we think about it a lot of times. Folks that snore quite a bit are diagnosed with sleep apnea, and you get a sleep study and you do some things and find out you need a CPAP machine, which helps force air into your mouth and your nose so you don't snore quite as much. And the unfortunate thing is a lot of us hear about sleep apnea and CPAP machines and we think, well, if you have trouble sleeping, that's probably the only solution there is to help cure your sleep or lack of sleep.
But there may be some other underlying things.
Really, there are quite a few other underlying things that could happen, and one of them that's coming up real fast is the time change. Believe it or not,
Yes.
as we switch the clocks around, it kind of throws off our rhythm for the day, and you may find yourself going to bed a little bit earlier, a little bit later, and you don't sleep as well for some reason. So there are a lot of things that impact the way that we sleep and how rested we feel each morning.
Well, we humans have something called, circadian rhythm?
We do. You must have read about that recently.
Well, it was interesting in one of the science publications that comes out monthly. There was some interesting publication of data when it comes to sleep. And overall, the more lack of sleep, the more they found it's equivalent to being drunk.
Mm-hmm. It is. And we don't think about the impact that sleep has on our overall health and our day-to-day activities. Numerous studies have been out there that talk about it. It's been the cause of a lot of the big man-made disasters that we hear about. Sleep deprivation was a huge factor in the meltdown at Chernobyl, the Exxon Valdez oil spill. The National Highway Traffic Safety Commission estimates that fatigue causes about 100,000 auto crashes per year and then results in about 1,500 deaths per year as well. So the amount of sleep we get, the quality of sleep that we get really impacts the way we function on a day-to-day basis.
And that leads to health issues.
It does.
In the long term.
It sure does. As we talk with a lot of our doctors at the medical group, we say, what are those issues that we all deal with on a day-to-day basis that we don't realize really do impact our overall health? And sleep and lack of sleep really has a lot to do with how we function and how our overall health is. Sleepiness has been shown to increase your risk of heart disease, diabetes. It can impact weight gain, things like that. So without realizing it, the way we sleep, the way we rest really has a huge effect on our overall health.
And it's an important matter that it's hard to detect. As an individual, you just think you feel the way you do, but you may
accept it.
Have been tired for years because you're not sleeping as well as you think you are, or you're snoring, or something that you may not even be aware of, and that's why you need to talk to somebody about it.
That's absolutely right. A lot of us think, hey, I just don't sleep very good, or this is just the way I feel every morning. We don't realize that this isn't a healthy pattern, and we've just gotten accustomed to it for years. That's one of the reasons it's so important to talk to somebody that knows a little bit about normal sleep, about the things that can impact your sleep. So what we decided to do was to set up an opportunity for patients to set an appointment, come have a 10-minute consultation with a doctor or nurse practitioner, and talk about their sleep, talk about how they feel when they wake up in the mornings, talk about some medications, risk factors, things like that that they take that may impact their sleep as well. There's so many things that we do that we don't even think it has an impact on our sleep. A lot of folks have pets in their beds with them. We all know that we like to snuggle up with our dog or whatever, but the dog likes to get up at 3 o'clock in the morning and wakes us up, and that interrupts our sleep. If folks drink alcohol before they go to bed at night, we think alcohol is going to help us sleep a little bit. Where in the beginning it acts as a sedative, but 3 or 4 hours down the road, when your alcohol level in your blood drops, it actually wakes you up. It jolts you awake. So that interrupts sleep as well. So there are a lot of those things that we do in our normal routine that really affect the way we rest.
Caffeine's going to play a big part in that.
Oh,
It's
yeah.
going to play a huge role in that. That's right.
And you talked about normal sleep. How yeah, this is a big debate. How many hours should we get for a good night's sleep?
Well, it is a huge debate, and right now all the research is showing that healthy adults need 7 to 8 hours of sleep per night, and that's on an average every night. It's not going to work if you get 6 hours for 3 nights of the week and then you do a power sleep and get 12 hours for the other 4 nights of the week. It's not going to average out.
Darn.
And those studies are showing that about 37% of the U.S. population, the adult U.S. population, is getting fewer than 7 hours of sleep per night. So,
Yeah.
we're all wired, we're connected. BlackBerry goes off, you check your email, you click on the news, whatever. It's just not restful sleep.
I must be an unhealthy adult because I don't get anywhere near that amount of sleep.
It's been, I can't remember the last time I got that amount of sleep
No.
progressively through, 7 days in a week. But if you think that you have some issues, and by all means, you take advantage of the free screening that's coming up.
Yeah, we encourage anybody to take advantage of these screenings. The screenings are all in Hannibal Regional Medical Group outlying locations. So that would be Canton, Missouri, Hannibal, Missouri, Shelbina, Monroe City, Missouri, and Pittsfield, Illinois. And what we ask is that you call the office, you ask them to schedule you for a screening so that the providers there have 10 minutes set aside to go over some questionnaires with you, talk a little bit about your health history, talk about your sleep habits, and then maybe lend some suggestions about next steps. If we need to explore going back and visiting with your regular doctor about some changes in medication or some further testing, that's what they'll recommend and help you do that.
Will they have you go to sleep during this process at all, or is it this just
No, I don't think we have
interview?
time to help anybody go to sleep. We may ask how was the sleep, but we're not going to have a bed in the back where anybody can lay down and play soft music or anything like that.
Yeah. All right. Well, first and foremost, try to get that 7-8 hours of sleep and do so on a regular basis. And then perhaps maybe if you realize it's still not working, then at least engage in some dialogue with your doctor.
Sure, and that's all we ask is that you go out, you talk to some of these providers that know about sleep and how it impacts your health, and talk to them, get educated. And if you have time, type in on the internet, how does sleep affect my overall health? And you'll read more there and learn that it really plays a big role in how we feel and how we look and how we function every day.
What do you say to the folks who are concerned about being set up with a CPAP machine or something like that, and they just don't want that?
Yeah, so like in the beginning, like I said, CPAP is more for the sleep apnea type things. So there's a lot more to sleep disorders than just sleep apnea. So like I said, it could be something as simple as moving your pet from in your bed to in a bed beside you just to help you sleep more at night. It could be as simple as, not drinking for 2 hours prior to going to bed, and that may help you sleep a little bit. So there's a lot of different tools out there other than just the CPAP machine to help us sleep and rest well.
Just have it evaluated.
Just have it evaluated, have that discussion, and find out what are the next steps and what are your options.
Okay.
All right. Aaron, for more information or to make an appointment for the screening, do we just call the main campus?
For more information, the best thing to do is call 573-406-5842.
Okay.
And at that number, you'll get more information about the snoring and fatigue screening. You can also go online to HannibalRegionalMedicalGroup.org, and that will have information about the medical group and the screening. Also on that page, you can find all the outlying locations and their contact information. So if you live close to Shelbina or live close to Pittsfield, Illinois, you can call that office and have the screening set up there.
Excellent.
All
Good to
right.
know.
We'll wake Mevs up here to play a little bumper music, and we'll wrap things up.
That would be great.
Aaron, always a pleasure. Thank you very much.
Gentlemen, thank you.
Thank you.
Did you get enough sleep last night?
I think I might have, but I haven't decided yet.
Okay,
I've had a
all right.
couple cups of coffee, so I'm feeling a lot better.
Excellent.
You might get screened, too.
I might get screened.
Aaron Zook, always a pleasure. Thank you very much. And that is this week's edition of Your Healthy Dose. For more information, HannibalHealth.org is the place to go. And it is brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group.